Good afternoon. Just like to call this meeting of Health and Human Services Subcommittee to order. Today, we are going to have 3 budget hearings. We're going to have, first up, MDH Office of Healthcare Quality. Second, we'll have Maryland Institute of Emergency Medical Services Systems, and then we'll have DHS Administration. At this time, love to bring up Ms. Ann Wagner to give the analysis for the MDH Office of Healthcare Quality.
All right, thank you very much, Mr. Chairman, members of the committee. Here, I'll just share my screen. Okay, so as you said, I'm presenting the budget for the Office of Healthcare Quality under the Maryland Department of Health. This office licenses and certifies several types of healthcare programs and facilities for compliance with state and federal health, safety, and quality of care standards. The fiscal 24 allowance provides about $34 million for this agency, which is an increase of about 1.2 million over fiscal 23. Moving to Exhibit 1 on page 3, this shows the allowance by the use of funds, demonstrating that over 90% of this budget, or $30 million, supports personnel. Exhibit 2 on the next page shows how personnel is split across the office's major monitoring units. The long-term care unit for surveying and licensing nursing homes makes up the largest share of personnel costs, followed by the unit that surveys and licenses developmental disabilities administration providers. Moving on to Exhibit 3, this shows an itemized list of changes in the allowance compared to the fiscal 23 working appropriation. Almost all of the increase in this budget is shown in personnel, and with the largest change being salaries and fringe benefits for 10 new positions, which I'll get into a little bit later. Moving on to personnel, Exhibit 4 on page 7 shows that vacancy rates and the number of filled positions have fluctuated over the past few fiscal years. Starting February 2021 through the end of fiscal 22, vacancy rates generally grew and eventually reached a high of 19%. Fiscal 23 year-to-date has shown improvement with vacancy rates as OHCQ was able to fill a net 11 vacant positions, and the most recent vacancy rate had decreased to 13.3%. On the next page, the analysis discusses OHCQ's budgeted turnover. This is a negative adjustment to salaries in every budget that accounts for vacancies throughout the fiscal year and the time it would take to fill vacant positions. Typically, when an agency reports consistently high vacancy rates, the budgeted turnover would correspond with that by also increasing. And you are seeing that in OHCQ from fiscal 2019 to 2022. The reported vacancy rates were around 10% or higher, and the budgeted turnover increased to 9%. However, in fiscal 23 and then again in the fiscal 24 allowance, OHCQ's budgeted turnover rate is set to 0%. By keeping the fiscal 24 budgeted turnover rate substantially lower than current vacancy rates or recent experience, OHCQ is estimated to save about $3.5 million in personnel funding that would have been spent on salaries and fringe benefits for filled positions. And so on page 9, OHCQ is asked to discuss how it will use personnel savings from these vacancies in fiscal 23. And then based on OHCQ's recent vacancy rates remaining above 10%, DLS is recommending an increase to the budgeted turnover to 7%. Moving on to the key observations section, OHCQ has certain mandated inspection requirements for its survey activities across each monitoring unit. So Exhibit 6 shows the office's survey rates for the developmental disabilities unit. And then Exhibit 7 shows the recent survey activities for the assisted living unit. And so both of these exhibits show that OHCQ has not been reaching its goal to survey all licensed providers for each of these units annually. And then moving on to Exhibit 8. This exhibit shows the long-term care unit's recent surveys through fiscal 21. The number of surveys conducted grew considerably during the COVID-19 pandemic as OHCQ had to temporarily conduct additional surveys directly related to COVID-19 infection control and reporting. OHCQ was unable to provide fiscal 22 survey data across these units and has not submitted managing for results performance data for this year, while the office is still reconciling survey information and records that were collected during the ransomware attack or network security incident on the department. The ransomware attack occurred in December 2021 and led to OHCQ's surveyors losing access to the database for tracking and managing survey records until May 3rd, 2022. OHCQ is still in the process of re-entering survey data from that period. And so the office is asked to comment on whether it will first be able to reconcile and add all fiscal 22 survey data onto its database and when it expects to submit fiscal 22 survey or actual survey data. DLS recommends adopting narrative that requests OHCQ to provide fiscal 22 actual survey data and a status update for restoring all OHCQ operations and meeting reporting requirements following the ransomware attack. So then the next key observation discusses mandated staffing support provided in the allowance. Chapter 454 of 2018 mandated that OHCQ receive 10 new positions each year from fiscal 20 through 2024. This was to help the office in meeting its mandated survey goals that were just discussed. And so Exhibit 9 on page 14 shows how these 50 new positions were distributed across monitoring units, with the fiscal 24 allowance providing the last installment of those 10 positions to round out the 50 new positions. The long-term care unit and developmental disabilities unit received more than 3/4 of these new positions over the period. However, when accounting for position transfers within the department, the long-term care unit ends up with a net reduction in positions in fiscal 24. And so OHCQ is asked to explain why positions are transferred from the long-term care unit in the fiscal 24 allowance. And finally, OHCQ is asked to discuss how the 50 new positions have impacted staffing adequacy, how the office is assessing its personnel needs beyond fiscal 24, and whether a new staffing study is in progress. The recommended actions I just discussed are shown on page 16. And with that, I'll conclude the presentation. I'm happy to answer any questions.
Thank you, Ms. Wagner. Are there any questions for the analysts? Seeing none, just want to say thank you again, Ms. Wagner, for your due diligence in reference to the analysis report. I'd like to at this time call up Dr. Herrera Scott and her team.
You, sir.
Yes, ma'am.
Good afternoon, Chairman McCray and members of the subcommittee. I'm Acting Health Secretary Laura Herrera Scott, and with me is Dr. Jinlene Chan, Deputy Secretary of Public Health Services, and Emily Brandenburg, our Chief Financial Officer. I would like to acknowledge Ms. Wagner and the DLS budget team for their insightful analysis and look forward to working with them and the committee staff during this budget process. Before I turn it over to Dr. Chan, I just want to go through our budget responses. I wanted to make clear that the Office of Healthcare Quality plays an incredibly vital role in ensuring that our licensed healthcare facilities follow federal and state requirements to keep their patients safe, healthy, and protected, and ensuring that OHCQ functions well as a priority. We're just beginning to do a deep dive with Drs. Chen and Ney, along with our human resource and finance teams, to help replenish and recharge OHCQ from the effects of COVID-19 and the ongoing sequelae of the 2021 MDH network security incident, to lay the foundation for the next few years as the staffing plan that was put in place in 2018 ends. I look forward to further discussions with you and your colleagues as we conduct our planning work. And with that, I'll turn it over to Dr. Chan to provide the responses to the DLS questions.
Thank you, Dr. Scott, and good afternoon, Chair McCray, members of the committee. Again, for the record, my name is Dr. Jinlene Chan, as the Deputy Secretary for Public Health Services with the Maryland Department of Health, and I'm really pleased to be before you today to discuss the budget for the Office of Healthcare Quality. I want to thank Ms. Wagner, as always, for her detailed analysis and presentation. You should have before you our written response, which is much more detailed. So today I will just be highlighting some of our responses. The first question that was posed was about the planned use of the anticipated FY23 turnover savings and our efforts to recruit and retain staff. We would respectfully disagree with the recommendations to increase the budgeted turnover to 7% and would support what is currently outlined in the governor's budget allowance. OHCQ has been diligently filling all vacancies, including these merit positions that have been provided every year in the 2018 staffing plan. OHCQ since July 2022, so about 7 months ago, has actually filled a total of 53 positions, including 39 surveyors. So as of January 31st, just a few weeks ago, OHCQ has 25 vacancies, and we have, even over the last few weeks, been in the process of interviewing to fill 21 surveyor positions. Our recruiting and retention efforts have increased or improved over the years, including promotional and creating promotional opportunities for staff, as well as offering additional more flexible work schedules, as well as taking advantage of the state's tuition reimbursement plan. All of that has resulted in improved staff retention as well as recruitment. To the extent that there are general fund vacancy savings this year, they will be needed to account for the anticipated decreased federal match for nurse surveyors that were hired in FY '24 or will be for next year. The department is not able to generate a federal match for some of the new trainees because until they are fully certified as nurse surveyors, we are not able to claim the federal match. The fund split for many of these new positions does not fully account for what those new hires and whether payroll and whose payroll will be charged 100% to general funds in FY '24. Any vacancy savings that we generate are also used to support additional special payments payroll support to basically meet additional mandates or new needs that may come up over the course of the year. The next question that was posed is about the OHCQ metrics related to the FY '24 MFRs, as well as the 2022 annual report and performance metrics. As Ms. Wagner alluded, and the secretary, our network incident that occurred in December of 2021 impacted all programs across MDH, including, of course, OHCQ. So we prioritize OHCQ for reconnection to all of their services and especially to their application Aspen, which is a federal system into which all data is entered. And so during that time frame between December and May, when they were reconnected and they were prioritized for reconnection, they worked closely with the regional office to ensure that work would continue to respond to complaint investigations and conduct survey work. The staff since then, and it was mainly a paper-based system that they agreed on working with the regional office. Since then, since they became reconnected, the staff have been working very diligently on entering all of the information since last May. And what we would emphasize is that there was no data compromised or lost during the network incident. And so in addition, there were no need for resurveys done. The staff did this all on paper and then are entering it in. And in fact, at this point, all of the federal survey information have already been entered in, and they are finalizing the state survey information. And you have some of the timelines there. So at this point in time, the data is, we are working on that. We have some timeframes, and this data is critical to us for our own planning as well, in addition to be able to provide it to you as our legislative body and our constituents. And so this is one of our priorities, to get that data and to produce the annual report. So we would respectfully request that the Budget Committee not adopt the language for an additional report on the status. We are working diligently on that. Next, wanted to clarify the question about the position movements within the long-term care program. So at the time when the FY '24 allowance was actually set, there had been 2 positions that had moved out of the long-term care unit, and it was to help to address a new state mandate, not federal, related to investigations of sexual abuse allegations. However, in the meantime, now we are in the process of transferring 2 vacant pins back into the long-term care unit. And this movement of pins across different units within OHCQ and adjustment of the work is something that we would typically do in an office of this size as mandates or needs change or as staffing shifts. As part of the written response provided, the total number of positions in the long-term care unit, as you can see, has increased quite a bit over the last 6 years, with plans to add more next fiscal year. Last, we were asked to comment on the staffing plan adequacy over the last 6 and next year being the last year, the 7th year, and how we're assessing staffing needs beyond FY '24 to meet future inspection needs. So it's absolutely clear to us that despite the network incident and the work done during the pandemic, which were both very significant impacts for the department, that the increased needed staffing support for OHCQ has allowed the office to better meet both federal and state mandates across all of its units. And we appreciate the legislature's support of the staffing plan that was put in place in 2018. We are continually assessing what the staffing resources may be needed to continue to meet the needs as they change or increase across all the units, including looking at trends in the number of facilities across the state. They have typically been growing, including in DD. And so we want to be able to meet those needs as well as the number of facilities in the Maryland grows to meet the needs of Marylanders. In addition, in FY24, as we're looking ahead, we will be receiving an additional 10 positions come July, and we anticipate that 5 of those positions will go into the long-term care unit. As I referenced before, the data for OHCQ's annual report is important to the work that we do internally as well for planning purposes. And so we are looking forward to having complete data for both our federal and state programs for that planning work. And we are right now beginning the process of developing a new forward-thinking staffing plan, working with Acting Secretary Herrera-Scott. So with that, that ends my comments, and I'm happy to take any questions.
2 quick
Thank you,
questions.
Mr. Chair.
Yes, ma'am. Thank you. 2 quick questions. One of them is, maybe I just didn't hear it or wasn't listening attentively. When is the annual report going to be due? Like, when do you all put it out?
The annual report we usually would put out in the fall of each year, but because the complete data was not entered into Aspen because of the network incident, we are trying to complete the entering the state information so that we'll have a complete report.
So when is the report going to be put out?
We anticipate before the end of this fiscal year. We are making sure that all the data is entered in. They're doing it unit by unit.
Would that be July or?
We hope prior to that. So
Okay.
that's our goal.
Got it. And the second one, you disagreed in reference to the turnover piece of it and reducing. Can you, do you have any recommendations in reference to how we follow it? Obviously, it was an issue in the previous years. While you disagree with the taking down the turnover rate, what is there something that you would recommend just to make sure that the legislature is following the issue?
Do you want
Or-
to take that?
Are you
Yeah,
saying as it
yeah.
relates to the vacancy factor?
Yes, ma'am. The vacancy.
Oh, yes.
So as that goes to the work plan that we're trying to develop, because we do have an aging workforce and because it takes a year for them to be independent surveyors. So we're trying to assess the workforce we have now, the workforce that will be aging out by when, and then how do we feed the pipeline coming in? And the goal of doing all that, plus the new net pins that we will be getting, that's what we're trying to figure out now. So the vacancy factor is not that high. But as Dr. Chen said, those monies are then still used to offset the delta for the surveyors that are less than a year, because we don't get the full enhanced match for them from the feds because they're not an independent surveyor. They shadow, for lack of a better description, or they have to be with a licensed independent survey when they're doing their work. So we're using those funds to offset the new people we're bringing into the pipeline, but the goal is to have new people coming in stage with the people that are choosing to retire.
Got it. I'm gonna open it up to the committee, see if there's any questions. Seeing no questions, just want to say thank you, Madam Secretary, Dr. Scott, and Dr. Chan and your team for the work that you all do for the state of Maryland.
Thank you.
Thank you, Mr.
Yes,
Chair.
Colleagues, at this time, we're going to bring up Maryland Institute Emergency Medical Service Systems. Oh. Apologies, colleagues. We're not going to move too quick. We do have testimony that would like to be given by Margot Quinlan. I don't see it. No. Okay, that does end the briefing in reference to the MDH Office of Healthcare Quality. And now we'd like to bring up Ms. Samantha Tapia.
Thank you, Mr. Chair and committee members. Again, Samantha Tapia presenting on the operating budget for Maryland Institute of Emergency Medical Services Systems. Just a reminder, MEMS is an independent agency, mostly funded by federal grants and special funds, led by an EMS board and a number of supporting councils. They oversee a wide variety of programs that you can read about in their annual report. The operating budget for fiscal 2024 sees a decrease of 15 million, or about 40%, down to 22 million. This is mostly due to reduction in general funds from a one-time pass-through funding to MEMSOF. And then also funding for the Doctor First project that is not scheduled to continue into fiscal 2024. There also reimbursable grants through, there also is a reimbursable grant through MDH for the Critical Care Coordination Center, for which they're searching for funding to continue into fiscal 2024. So where do the funds go? 62% goes to personnel, 98 regular and 20 contractual employees, 18% to communications, and the remainder in operations and grants. 1.24 million of which goes to support a number of training programs and provision of defibrillators and naloxone kits. Apart from the general fund changes already mentioned, largest positive and negative changes are both in personnel. The loss of 19.5 contract positions for the Critical Care Coordination Center, offset by increases in benefits and cost of living adjustments that we see across agencies, and 3 new positions for EMS communications. There's also a there was also the one-time funding for the EMT stipend program, also a CDC grant that is not continued into fiscal 2024. Moving on to key observations. We have EMTs and the non-emergency medical transport system involving a release of funds and 2 requests for commentary on hospital capacity. As for the EMTs, there was an executive order in the beginning of calendar 2022, easing restrictions on EMT certification levels to expand the number of available EMTs to serve the population. And then a CDC code grant was provided for workforce development, as already mentioned, for the EMT stipend program. Exhibit 3. Shows a breakdown of the stipend awardees and awardee progress, with most of the, well, about a third of the stipend awardees having completed the course, and most of the other awardees still in progress, having reached at least 1 milestone. There is a small percentage of awardees that have withdrawn, but the funds that were provided to those awardees are being reassigned to new awardees as the a sufficient amount of funds comes available. And the non-emergency medical transport program, there was a JCR request last year for information on emergency and non-emergency transport for Medicaid patients after there were concerns about transfer times and the billing process. The primary solution to this is that MEMS is working with MDH on enrolling a new ASO to provide those services. And there's more details on that in the report and how that is going to be developed and phased in across jurisdictions. But we believe that all the points that were required for the JCR requests were met, and we've recommended release of the withheld funds if there are no objections raised by the committee. And moving on to hospital capacity. The Critical Care Coordination Center coordinates EMS patient delivery and transfer according to hospital capacity across Maryland and in neighboring states. It's been largely successful and was expanded in the last year to serve pediatric patients. MEMS has been looking for new funding after the expiration of the CDC grant is scheduled for the end of July. And we've asked them to comment on what options they're considering for procuring that new funding. Second issue for hospital capacity is regarding the chat system, county hospital alert tracking system, which runs according to a statewide alert level system, which you can see in Exhibit 4 on page 11. And so this reports conditions at hospitals according to these different alert levels, and most notably the yellow alert level. MEMS has provided some data showing the increase in yellow alert rates across a number of years. The key issue related to this is the use of this data. As of December and January, there was some difficulty in downloading the data from the online tool on the MEMS website for use in research or policy analysis. So we've also requested commentary on what MEMS is doing to correct that. And apart from that, we agree with, concur with the governor's budget. The rest of the analysis you can see has the JCR reports and information on the communications upgrade project, as well as the object fund difference report summary. And with that, I can take questions or defer to the agency for commentary. Thank you.
Senator Zucker.
Thank you very much. How are you? Good to see you. Thank you for all your help. So the $15 million decrease, is that that's because of the feds?
That is the infusion to MEMSOF. That was one time last year.
Got it.
MEMSOF, yeah.
But because of COVID and feds, is that why or no? Is it-
I believe that they're, I probably shouldn't comment on MEMSOF
No
on
problem.
budget, but
Thank you.
yes.
Thank you very much. Thank you.
Thank you, Senator Zucker. Seeing no other questions by any members of the committee at this moment, I'd like to bring up Mr. Executive Director Delbridge.
Thank you. Good afternoon, Chairman McCray and members of the committee. And I understand that you have my written testimony. I'm sure you've read it, and I'll try not to belabor the point, but I'll try to answer that last question first. Last year, there was an infusion of $10 million into the Maryland Emergency Medical Services Operation Fund because the fund is funded. It's infused with a surcharge on registration fees from the Motor Vehicle Administration. And there was a decrement in that owing to COVID and deferrals. And the fund is on a trajectory to decline over the next couple of years in its natural course, there was a move to infuse the fund to make sure it was propped up. It funds the Maryland Emergency Medical Service Operation Fund funds almost the entirety of the MEMS budget, a good portion of the Maryland Fire Rescue Institute budget, grants for volunteer infrastructure, and 80% of the Maryland State Police Aviation Command, as well as a stipend to the R. Adams Kelly Shock Trauma Center. And so to keep all that going, the $10 million was passed through. The remainder is federal grant money that represents the decrement. That makes sense. We're grateful to Ms. Tapia for her analysis, and also to our DBM budget analyst, Rebecca Bazzari, and we concur with Samantha's findings. I'll touch on a couple of things. She mentioned the EMT stipend, which is a CDC workforce grant that's managed by MDH that comes to MEMS. We, over the course of time, have expanded the ability to train emergency medical technicians in the state, which represent the backbone of the EMS workforce, and essentially a starting point for many people in their emergency medical services career. But we suffer from a fair amount of attrition from those courses. The stipend was an experiment, if you will, to see if incentivizing people to continue in the EMT course and pass the registration, the certification examination at the end, if that would help. We had enough funding to fund 500 people. I believe 280 of them have completed up till now, updating Samantha's numbers, 280 have completed their training. Another 180 some are in flight, have gotten partial payment. And some are at the very beginning. We've had a handful of people drop out, and over time, the goal is to see if providing a stipend keeps people engaged in training throughout its course and decreases the rate of attrition. And so we'll have an update this time next year. She mentioned the non-emergency medical transportation program report. That was a project we did in collaboration with MDH, specifically Medicaid, to determine if there was a better way of managing non-emergency transportation for Medicaid beneficiaries. It turns out MDH was mid-flight in a project to identify an administrative service organization. They're still in that process. I think they've gone through a round of RFPs and have some clarifications to provide, and will hopefully make something happen within the course of the next year. The Critical Care Coordination Center was a COVID invention designed to help hospital emergency departments and hospitals in general identify critical care resources for their patients who need critical care when it wasn't available in their facility. Since December of 2020, we fielded more than 5,200 calls from Maryland hospitals and arranged transfer to places where the appropriate intensive care resources were available. It's been a huge success. As Samantha pointed out, the funding for that is through a CDC grant that runs out at June 30th. We're actively working with the Department of Health Office of Preparedness and Response to identify additional funding to keep it going. It turns out that most of the calls relate to something other than COVID. And so its need is particularly apparent, and was really apparent during this past fall when we saw a surge of pediatric respiratory illnesses in hospital emergency departments. It was a huge help to the healthcare system. We mentioned CHATS, the County Hospital Alert Tracking System. It's a way that hospitals can notify the EMS system when they're in a particular level of distress and prefer no EMS traffic come their way for some period of time. It is an antiquated system that's been around for almost 20 years. And we are actively working with CRESS, the Chesapeake Regional Information System for our patients, to develop a more automated way to provide a score, a metric for EMS personnel to refer to that would indicate the current ability of hospitals to accommodate newly arriving patients and not rely on hospitals to go to a computer and enter the data themselves. The CRESS CHATS works right now. It might stop working tomorrow. For real-time data acquisition, it works. If somebody wants to go to CHATS and run a report about what happened for the past year, really the only way to do that right now is through MEMS personnel by contacting us and our IT folks to be able to do it. We've removed the front-facing piece, the public-facing piece, away from the data analysis in order to keep it going. And I think I've covered all that was brought up. I'm happy to try to answer any questions.
Thank you, Director Delbridge. Just a couple questions. When looking at page 3 in the report and looking at the previous report from last year, it looked like it was like a $400,000 bump to grants to local jurisdictions. If you could just kind of speak to like what type of grants that we're talking about.
We for several years, many years, have provided grant funding to the EMS. There are 5 EMS regions, and the money is distributed to the 5 EMS regions based on their population. And the EMS regions then identify worthy projects amongst EMS operational programs, the folks actually delivering emergency medical services, for the purposes of purchasing cardiac monitoring capabilities. This was initially conceived a while back ago as cardiac monitoring was becoming more sophisticated, and we wanted every EMS operational program in the state to be able to obtain 12 lead EKGs on the scene of somebody, for example, having chest pain. These grants were instituted and they have continued in perpetuity till now. And each year we get requests for grant funding of more than we have available to actually distribute. But it relies on the entities, the EMS operational programs coming with their ideas to the regional councils, and the regional councils then roll up to us, and we distribute the funds and make sure that they purchase the equipment that they identified. And it's a 50-50 matching thing. So the state puts in 50% and the local jurisdiction matches with at least the other 50% to buy monitoring equipment.
Thank you. It looked like on page 6, it say 5 of the positions have been vacant longer than a year. If you could just speak to what those classification of positions are.
I'm sorry.
On page 6,
Yes, sir.
at the first bullet point, it talks about of the 13 vacant positions, and then it specifically says that 5 of the positions have been vacant for longer than 12 months.
They are communications engineering positions and IT. We operate an EMS communication system where an EMT or paramedic anywhere in the state can speak to a physician for medical direction nearly anywhere in the state, and conference folks in. We operate radio towers and that are the responsibility of MEMS, as well as radio towers that are, for example, operated by the State Highway Administration or Maryland First and other entities. The communications engineers keep all that going. And we have a few vacancies in communications engineering, which are hard to fill. Our salaries are not competitive with what people with those same skill sets can get on the outside, and even in other parts of the state. So we're constantly working to make the positions more attractive and identify people with the right skill set. The other ones are in information technology and information management, which are similarly have similar challenges. We have worked to bring on, for example, interns and get them excited about the work that we do and get them to stay. And so some of the contractual people that are listed here are offsetting those vacancies. We would much prefer to have regular staff than be using contracted labor.
Is there a plan that exists or some level of a path forward in reference to filling these positions, the 5 classifications that you just discussed?
So we're working with DBM to reclassify some of the positions and change salary structures. We are constantly working to redefine the jobs and make them attractive to entry-level folks.
Got it. The next question is in reference to the scholarships, the 500 scholarships.
Yes, sir.
And I followed the issue to some degree and was able to read some of the reports that you all have put out. And it looked like you did a really good job of the timeline and where folks are within this space. But I couldn't see, like, was this a first in, first out type of thing? Was it a rubric set for who got scholarships? So I would like to hear how that worked. Also, if there was any demographic information and also geographic information in reference to the young people or the students, the 500 students that we're talking about.
Sure, those are really good questions. And I'd have to get back to you with the people in our place that are actually administering the scholarships and in touch with the folks. The way we recruited people to be part of this was through a lot of advertising through the educational programs themselves. So we reached out to the educational programs to make so that they would let their students know this was available to them, and we advertised in social media kinds of ways. I can tell you we pay close attention to where the students are, not geographically, but where they are in terms of the sort of program that they're in. So emergency medical technician training is offered by the Maryland Fire Rescue Institute, so entirely volunteers. Many community colleges in the state, and some training academies that are like county EMS fire department based. I can tell you that the vast majority of, I'm not sure I have those numbers here, the vast majority of people are enrolled in the Maryland Fire Rescue Institute, so are volunteers. The next portion of people, but more than 200. The next rung are people enrolled in community colleges, so people who are paying tuition themselves. And then a small number are in county volunteer agencies. And I'm happy to provide more demographic information. I'll have to get back to you on that.
No, I definitely look forward to the information. Just quickly, if you know, and if not, I'll get it in the information. Was it like Corey McRae's first to apply for it, or was there some level of a panel and folks chose who got the scholarships?
First to apply.
Okay.
And then when we ran out of scholarship, so we have designated 500 people to receive the scholarships. When we ran out, we created a waiting list. And so as people drop out or we lose contact with them, we go to the waiting list, and the waiting list is essentially exhausted.
Yep. And my last question, and just want to thank the analysts again. I was able to read the report in reference to the ASOs, and it sounds like you all are at the space now where you have gotten the RFPs back. But I was curious, like how many RFPs was?
So that wasn't our gig. That was managed by MDH and the Maryland Medicaid.
Mhm.
So what I know is what they've advised. Don't have firsthand knowledge, but I understand that they received responses to their RFPs asking for clarification. I don't know that they actually got a response that was a proposal to do the work.
Okay.
I know that they're refining their RFP and intend to reissue it.
Oh, okay. The report didn't say that. Thank you again. I'm going to open it up to see Senator Jennings.
Thank you. I'm going to go back to the EMT with regards, it's not more of the training, getting them certified. It's afterwards, keeping them certified in writing. And I guess the biggest issue is in the volunteer sector, volunteer fire departments, whereas career, I mean, that's your job. So you have to keep your certification. What are you seeing? And I see here, they're asking about the decrease in number of active EMTs. I know Baltimore and Harford County, I believe, have, they're paying volunteers. What other programs are you guys trying to do to keep people active, staying in their volunteer system? And I speak as a former volunteer, former
sir.
EMT.
Yes, sir.
Who said, I just can't keep up with it and let my certification expire. That, I always feel guilty. I want to get back into it, but I don't have the time. And I look at the volunteers that are out there, and it's a lot of stress on life, keeping up with the certs they have to do, and just curious what we're doing.
So when EMTs or any EMS clinician bail out, don't renew, don't keep up with their certification, we survey them to find out if there is a common thread that we might have an effect on. The most recent recertification cycle for emergency medical technicians was at the end of December. Timing being what it is, they have till this Friday actually to respond to the survey when we'll analyze it. And there generally isn't that common thread. People leave the field because they ran out of time. So they develop family commitments, or their day job consumes them, or they just feel like they've done it long enough and they retire. I think what we can do is keep people engaged at our level, is keep people engaged and make it as easy as possible for them to do the things they have to do to stay credentialed. We have resisted, for example, adding continuing education requirements that are more of a national trend in order to not overburden the EMS clinicians and cause them to have commitments that they're unwilling to meet. We're always looking for good ideas. We rely heavily on the Maryland State Firemen's Association for ideas too, and work closely with them to make sure that we're in sync and being cognizant of the demands on volunteers specifically to make sure that we're not overdoing it.
Okay, thanks. One more question. Emergency wait room or waiting times. We've gotten complaints from several of our ambulances that they're having to wait extraordinary long times. And I understand these hospitals are overwhelmed. Has that lessened? Are
No,
we getting better? Is it getting worse?
well, I wouldn't say it's getting worse. It's not getting better.
Not getting better. You know what the average time now is for an ambulance?
Well, the average time is probably about 27 minutes. Our goal is that hospitals ought to be able to accept incoming EMS traffic so that the EMS to emergency department transfer interval, meaning for the time it takes for the emergency department staff to accept responsibility of the care for the patient, we want to happen within 30 minutes, 90% of the time. There are about 25% of Maryland's hospitals that meet that goal. And some of them, that 90% care interval exceeds an hour, and there are a few that exceed 90 minutes, which from our perspective is totally unacceptable. It is a complicated problem to manage. It has gotten to, well, I don't want to be dramatic and say crisis, but it's problematic. I was actually invited to speak to the HSCRC, the Health Services Cost Review Commission yesterday on this topic to get their attention and determine if there are incentives or disincentives that they can lever with their hospital partners to make this an issue. I think that we have done things to try to get the hospitals to collaborate. We convened a group of hospital emergency services leaders throughout the state, had participation by every hospital in something we called the Collaborative for Hospital Emergency Services to get them to share experiences, because there are some hospitals that do this well, and there's some hospitals that do this really not very well at all, unacceptably not well, and get them to share their perspectives on this. That has nothing to do with how busy an emergency department is generally. It doesn't have anything to do with how busy they are in terms of receiving EMS patients in general. There's nothing to correlate this with. It is the internal workings of the hospital that matter.
So I was under the understanding that it was all about the emergency room was just busy. That's
Well,
why they couldn't take the handoff.
Well, the
So
emergency department itself might be busy, but if you, for example, some of the top 10 busiest receiving hospitals for EMS traffic in the state meet this goal or come really close to it. Some hospitals that receive few EMS patients as either an absolute number or a proportion of their overall emergency department patient volume don't do so well. And so there's nothing to correlate it with. It probably trying to characterize this correctly. If I was to point a finger at a thing, I wouldn't say it has exclusively a matter to do with the emergency department. It has to do with the overall operations of the hospital and the philosophy of the hospital in managing arriving traffic, and how the hospital views its emergency department as the front door to the hospital or not. So at any given moment in time, 20 to 30% of Maryland's emergency department treatment space is being occupied by patients whose emergency department care is complete, but have nowhere to go next. It's not atypical for, at any given moment in time, there to be 100 behavioral health patients stuck in Maryland's emergency departments with no place to go. It's not atypical for there to be 400 or 500 people who are in the queue to be admitted to the hospital, but there is no bed available for them to be admitted to. And that probably is the biggest factor in terms of the ability of the emergency department to accommodate a newly arriving patient.
Thank you, Senator Jennings. Senator Hadelman.
Thank you, Mr. Chairman. I just want to follow up on that because this is really concerning. And if there's anything that we can do to help this, there must be best practices out there. And I understand it's a systemic issue, but it's very concerning. So if there are things that we can do with the Maryland Hospital Association or what have you, please let us know.
Well, I believe there's legislation pending in the current session, both in the House of Delegates and the Senate regarding creation of a commission to study this very issue, which I think will be helpful.
Okay, thank you.
Mr. Delbridge, Director Delbridge, just want to say thank you for your leadership for our great state of Maryland. And at this time, colleagues, that ends Maryland's Institute for Emergency Medical Services System. At this time, I'd like to bring up Ms. Naomi Kamaro to give us the analyst report for DHS administration.
Okay. Thank you, Mr. Chairman. My name is Naomi Camaro. I'm going to be presenting the fiscal 24 allowance for the Department of Human Services Administration, which provides overall operational support, including financial services and IT management for DHS programs and activities. As you can see from this chart, the fiscal 24 budget increases by 5.4% to $291.5 million. Skipping to page 4. Pardon me. I wanted to highlight one performance measure that DHS captures related to the provision of care, or rather the receipt of care by children in out-of-home placements. So the Citizens Review Board for Children reviews cases of children in out-of-home placements and then makes recommendations to the relevant local Department of Social Services, which is provisioning the care. And as you can see from the chart in Exhibit 1, the number of cases in which children have received appropriate educational services and health services has been decreasing since fiscal 2019. That yellow line indicates the percentage of cases that have been submitted to the local Department of Social Services within 15 days of report completion. And so I just wanted to highlight that even though that number is coming up, this is a measure that is used to assess DHS's oversight of ensuring that these children are receiving appropriate care and receiving it in a timely manner. On page 6 begins the discussion of the fiscal 24 allowance. First, the allowance includes 2 proposed deficiency appropriations. The first is for OTHS to decommission certain legacy IT systems that are transitioning over to MD Think. That deficiency is $15.3 million. And then the remaining $879,000 is for the Montgomery County block grant. Montgomery County receives its funding for the local Department of Social Services in a slightly different way than the other local departments, which gives them some flexibility in how they fund their personnel costs. And so this deficiency is just correcting a fund split issue. Exhibit 2 on page 7 shows the breakout of the fiscal 24 allowance. So as you can see, about 40% of the budget is allocated toward MD Think expenses, 16% to other IT systems managed by OTHS, and then nearly 30% to personnel costs. Exhibit 3 on the following page shows the line item changes. I'm just going to point out a couple here. First, beneath information technology projects, you can see a $15 million increase due to increased costs from Amazon Web Services, which hosts MD Think. On the following page, There's a negative $15 million change for the deficiency appropriation that I mentioned earlier to decommission some of those legacy IT systems that are transitioning to MD Think. There's also $3.8 million for rent for the new DHS headquarters in downtown Baltimore. And then the last line of this chart is a decrease of $3.2 million. This is related to the Maryland Legal Services Program, which provides legal services to children involved in SINA cases and termination of parental rights cases. The DHS administration noted that there was a bit of a drop in demand, and then there was also available federal funds to fund this purpose. The next page has a table of personnel changes. DHS administration had, as of the end of December 2022, a vacancy rate of 12.24%, which equates to 93 vacant positions, which is 51 positions above their budgeted turnover. This is reflective of a department-wide vacancy issue, which I will turn to now. And so across the entire department of DHS, as of January of this year, the vacancy rate was 15.2%. So 910 vacant positions out of the nearly 6,000 that they have authorized. About a quarter of the current vacancies have been unfilled for more than a year, and then 47% were vacated in the last 6 months. Exhibit 4 shows the number of filled positions and the number of vacant positions as of January 1st in each of the last fiscal years. And so looking at this data, you can see that the number of filled positions has been decreasing while the number of vacant positions has been increasing. And then the red line is the percentage of positions filled, again, at January 1st of each of these 10 years. In terms of the individual units of DHS, all of the units are experiencing high vacancy rates, but the Social Securities Administration has been experienced the highest number, and it also has the highest amount of authorized positions. DHS has also said that its concern, its priority in terms of addressing vacancy issues is with public-facing roles, most of which are within the local departments of social services. And so with that in mind, turning to Exhibit 5 on page 12, these are 4 programs managed by the local departments of social services. So the Family Investment Administration, Child Welfare, Adult Services, and then the Child Support Administration. In general, you can see that between fiscal 21 and fiscal 23, the proportion of filled positions has been decreasing, except for a slight increase between 22 and 23 in family investment and child support. Another issue related to the vacancy rate is the amount of time that positions have remained vacant. And so Exhibit 6 shows for 4 specific positions within each of those 4 programs on the prior exhibit, how long the proportion of vacancies have been vacant for. So the yellow shows the amount of vacancies that have been vacant 0 to 6 months, again, as of January of this year. The orange is vacancies that have been vacant 7 to 12 months, and then the red is vacancies that have been vacant for a year or more. So to address this, DHS has taken several steps, and the 2022 Joint Chairman's Report requested that they turn in a report outlining the various strategies that they've taken up. And in that report, DHS identified several barriers to addressing the vacancy rate, which include low employment rates nationwide, especially since the COVID-19 pandemic, the ability to which they're able to offer competitive compensation, the ability to which they're able to offer flexible work environments, as well as offering professional development opportunities and internal growth opportunities, as well as some barriers to entry for entry-level positions that are limiting the candidate pool. And so on the screen now, you can see the start of some of the strategies that DHS has taken up to address this. The first is to adjust some of the minimum education and experience requirements for some of their entry-level positions in order to broaden the candidate pool. They've taken steps to streamline the recruitment process to make things a little bit speedier. They've also employed the expertise of a marketing specialist to increase the visibility of themselves as an employer in the space. DHS has also made various salary adjustments, both for existing employees and for recruitment purposes. And then they've also worked internally to engender a more balanced work environment and taken steps to work with supervisors and managers based on feedback they received from exit interviews with departing employees. On the next page is a discussion of the vacancy savings that DHS has garnered due to having a higher than budgeted vacancy rate. And so the 24 allowance includes $10.5 million in adjusting, in order to adjust salaries. And so DLS estimated based on that it would cost about $6.6 million for salary adjustments in the fiscal 23 year. And so looking at how much they're saving due to the higher vacancy rate and factoring in that $6.6 million spent on salary adjustments, DLS estimated that there would be about $16.8 million in surplus essentially. And so that's why we've asked DHS to comment on how they plan to spend that money. This next section of the page talks about the utilization of contractual full-time equivalents to backfill urgent needs. In fiscal 22 and 23, DHS employed 280 contractual FTEs across the entire department. And that includes 188 that were paid for using American Rescue Plan Act dollars for SNAP cases. Exhibit 7 is just comparing regular employees tenure with contractual FTE employees tenure, and just underscores the point that that contractual FTEs are really for acute urgent needs. And DHS is taking steps to ensure that they can convert as many of those contractual FTEs as possible to regular full-time positions. All right, on page 16 is the second issue that I wanted to bring to the committee's attention just very briefly. MD Think is the Maryland Total Human Services Integration Network. It's a platform meant to connect various data systems across DHS as well as other state agencies. The setup phase for MD Think is set to conclude this fiscal year. And so as of fiscal 24, DHS is moving into the maintenance and operation phase. And so the allowance includes $135 million for maintenance and operation expenses. And DHS has reported transitioning all planned legacy IT systems over to MD Think. And so this timeline in Exhibit 8 just shows the different data systems that have been decommissioned and transitioned over to MD Think, which was completed at the end of December of 2022. And then I'll just conclude with the 3 recommendations DLS has for this committee. The first is to restrict $1,000 of general fund appropriation. This relates to repeat findings from an audit that was released in March of 2022 regarding the DHS oversight of the local departments of social services. The second recommendation is to adopt committee narrative requesting an update on DHS's recruitment and retention strategies. And then finally, the last recommendation is to adopt committee narrative requesting a report on external utilization of MD Think. And so looking at what other state agencies might be able to use the platform to manage their data systems. I'm going to conclude my presentation there. The report includes standard appendices with summaries of JCR responses, as well as more information on the audit I mentioned. Thank you, Mr. Chair.
Thank you, Ms. Kamara. And I believe my colleague has said 100,000 restriction of 100,000.
What did I say? Yeah.
1,000.
Oh, 100,000. Yes, correct.
Yeah. And seeing no questions at this moment, I would like to just thank you, Ms. Kamara, for everything that you do to make sure lifting up Maryland and just the analysis that you had given. But at this time, I'd like to bring up Mr. Acting Secretary, Mr. Rafael Lopez and his team.
Good afternoon, Chairman McCray and members of the committee. I'm honored to be here with you. My name is Rafael Lopez. I'm serving as the Acting Secretary of the Department of Human Services. Thank you for the opportunity to discuss our department's administration budget for fiscal year 2024. And I'd like to take a moment to introduce the folks at the table with me and some of the team that's behind me. First, to my left is Daniel Waite, Acting Deputy Secretary of Administration, and to my right is Stafford Chipungu, our Chief Financial Officer. In addition, I'm joined today by Lashira Ayala, Executive Director of the Family Investment Administration, Denise Conway, Executive Director of the Social Services Administration, Kevin Geistweit, Executive Director of the Child Support Administration, Patrick O'Malley, DHS Chief Portfolio Officer for MD Think, Marva Sutherland, Inspector General for DHS, Denise Wheeler, Director for Citizen Review Board for Children, and Susan Coppage, Director of Queen Anne's County Department of Social Services, as well as Stephen Liggett-Creel, the Director of Washington County's Department of Social Services. And of these two last individuals, I did want to raise the importance of we're trying to model this particular year as we're going to budget hearings of deepening our partnership with all 24 local jurisdictions. We can't do anything statewide unless we partner deep with each of our partners in the local departments of social services, one of the matters that was brought up in the budget analysis. So we're here to answer any of the questions you might have. And before diving in, I want to take a moment to thank Naomi Kimuro for her comprehensive analysis of our department's budget and her continued support of our questions. All of you have received my written testimony, so I'll not repeat that, but I do want to lift up a couple of key items that are on our minds in response to the questions you have presented. Top of mind for me, as the newest member of the DHS team, are the over 1 million Marylanders who we have the honor of serving every single year. And as I think about coming into this role and serving as acting, and should I be confirmed by the Senate, you will have in me an authentic partner who will work every day to generate solutions and deliver better results for some of our toughest challenges facing families in Maryland. Together, we will be relentless in the pursuit of excellence as we make sure that the people we serve receive the help they need when they need it. Together, we must model with our actions and not just our words that the people who come to us for help are already filled and full of beauty and grace and intelligence and promise. And together we will make sure that every single person who does engage us, whether in our offices, on the phone, via email, or on the streets, walk away feeling that they were treated with kindness, respect, and dignity. And we believe that Maryland deserves nothing less. With that said, I'd like to turn our attention now to the recommended actions, audit findings, and issue areas. First, we concur with the 3 recommended actions, and we will move forward based on those recommendations. On the issue of the audit findings, the department has already corrected audit finding number 2. For the remaining 4 findings, we will move forward with a comprehensive corrective action plan. As I have shared with our senior leadership in the context of reviewing all of the audits and preparing for these budget hearings, we must move away from a pattern of repeat findings. And with that said, when there are systemic issues that are challenging the department further, we will be direct and transparent with coming to you with a corrective action plan and making sure that we're lifting up why it is that there are repeat findings and working with the auditors and others to make sure we're solving these issues once and for all. I can assure you the department will work diligently to correct all of these findings. With that said, I'd like to turn our attention to the 4 issues brought to our attention. Issue number 1, which has to do with continued improvement to turn around our timeliness with the Citizen Review Board for Children. And the way in which we intend to do this in this next year is to increase consistency in the use of supervisory tools and data to track performance. Second, to increase staffing by proactively filling the existing vacancies. And third, reviewing options and implementing a system to automate basic reports, which includes things like the use of a checklist by our staff with all post-review processes to more effectively track report due dates. Similarly, we will encourage supervisor bi-weekly reviews of on-time report recommendations. On the issue related to number 2 on page 15 of the analysis, this one has to do with the question of how we intend to use any additional savings, which are higher than budgeted vacancies. We have a 4-point plan as of this point in time on how we intend to use any such savings. Number 1, we will cover any potential deficits during the fiscal 2023 closing. Number 2, we want to add to the TANF balance. We've all learned through the COVID pandemic, the increase that happened in need. We want to be thoughtful about that and plan ahead. Third, we will reimburse DHS clients whose cash assistance benefits are stolen by card swipe fraud. We all know here in the room that this is a national trend. Maryland has no exception, and we're working diligently on a plan moving forward to reimburse people who are the victims of theft. And fourth, and finally, we intend to increase creative resources to recruit and retain staff. In fact, we have a moment, if you'll indulge, and with your permission, we're swapping the order of responding to issues 3 and 4 so that I could address 4 quickly and then get to number 3 and specifically highlight some of these issues for you. So issue 4, which was on page 18 of the analysis, was specifically addressing the issue of how we're thinking about MEMD Think and transitions. So right off the bat, we concur with the recommendations provided in the report, and we are already beginning to identify agencies that have transitioned or will transition their IT systems to MD Think. The timeline for those transitions, as well as projecting out any additional costs related to this transition. The way in which we've discussed our vision for moving forward with both the MD Think team, the leaders, as well as other cabinet acting secretaries, is to imagine that the first set of years of investment is around really laying the groundwork and the important foundation to reimagine how we're using technology to drive our strategy. And this next new chapter is around making sure that all these systems work really well for the staff who are doing this work every single day, and most importantly, for the people we serve who need access to that kind of a system to get the help they need when they need it. With that said, I'd now like to invite our Acting Deputy Secretary of Administration, Dan Waite, to walk you through issue number 3. We think it's important to be responsive to the legislature, and we'd like to take this time to briefly walk you through a few slides which have been provided to you with additional information. Bottom line, we concur and want to share some early thinking about a more proactive approach to begin course correcting the issue of vacancies and how we're approaching investing in our team moving forward. Dan?
Thank you. Mr. Chairman, members of the committee, my name is Daniel Waite. I am the Acting Deputy Secretary for Administration for the Department of Human Services, and I am also the Director of Human Resources for the Department of Human Services. We felt, as we looked at the issue number 3, that this is one of the absolute priorities for this department and for the state as a whole. So as we looked at the idea of updating this committee on our efforts to recruit and retain staff, we felt waiting until October, which I think was the recommended date, we would talk to you today about where we are and where we want to go. I hope that you were provided with a copy of our slide deck. I was hoping to use your nice technology, but we'll go analog today. So the second page of the deck is a historic graph of vacancy rates within the department going back to 2018. And one of the things that is key to understand as to give context as to why we're here today, why the state is facing in general the vacancy rates that we are, is to acknowledge the hiring freeze that we had during COVID. That's not to Monday morning quarterback that hiring freeze. Certainly at that time, decisions were being made that had to be made, and the fact that they may have had unintended consequences, we can't second guess at this time, but it is a fact, it's a reality, it happened. If you look at the graph, you'll see that from 2018, and really this goes back to as far as 2010,
We need to make sure. So we cite the page number.
Oh, yep. Yes, it's very small on my page, I think.
Does everybody actually on the committee have one? Okay, that's important. So let's give copies to our
Yes.
senators so that they know what we're talking about.
Thank you, Catherine. Catherine's gathering copies.
So we're on page 2, senators.
Yes, right.
That actually, no, that you interrupted for the right reasons, which is to make sure you have what we're talking about.
Yes.
Thank you.
Thank you so much. Okay, so looking at the slide on page 2, again, you will see that from 2018 to 2020, and if you really look at the red line that crosses the graph, that is March of 2020. And on March 1st, 2020, the department was at near historical lows in vacancy rates, over and above our required holdback of 7%. And we had established for a number of years
a plus or minus 1.5% over that required holdback vacancy rate. We were at that equilibrium. And then the hiring freeze occurred. The good news is we've reestablished that plus or minus 1% vacancy rate. The bad news, we've reestablished that at about 15%. So we've stabilized. If you're thinking about this as a patient, we've stopped the bleeding. What we're going to talk about next is how do we now grow from there and have a significant impact on the vacancy rates going forward. So as leaders, we're often asked, what is the thing that keeps you up at night? And the graphic on page 3 of the slides is that thing for me. The question that I ask every day is, are we in a negative reinforcing cycle that is caused by the fact that staff leave, workloads increase, staff leave, workloads increase, and the cycle continues? So the obvious question is, how do we break that cycle? So for the next couple of slides, I'm going to talk about what the department's plan is, things that we've implemented, things that we've tested out, and things that we look forward to doing in the future, in the very near future, to break us out of that cycle. So our plan has 5 pillars. The first pillar is deepening the pool of candidates, removing barriers to entry to our entry-level jobs specifically. Not only does that help us break the cycle, it's the right thing to do. And the reason that it's the right thing to do is that we understand that barriers to that college degree requirements are often a barrier to entry, not just to in general, but they disproportionately impact underserved communities. So the very people that we are here to serve, those requirements in the job specification prevent us from hiring them. So in March of 2022, for our family investment specialist entry-level position, we removed the college degree requirement. We have substituted that with a high school degree requirement, and essentially 6 months of work experience in just about anything. We want to make sure that those jobs are accessible on a very deep level. Thank you so much, Naomi. So as we had success with the family investment specialists, and we have dropped the vacancy rate for the family investment specialists by nearly 5% since March, we then worked to mirror those job specification changes within our child support specialist series. And in December of 2022, we received permission and approval to make that change in child support. So that's the first prong. And it's not just those two. Those are our pilot. Those are our rapid prototype. We are continuing to look at other places where we can remove those barriers to entry. The next pillar of our plan and what we have been executing is streamlining recruitment processes, taking the bureaucracy out of the bureaucracy. We started that, and I have to thank our partners at the Department of Budget Management for working with us on these issues. We started that by moving to a posture of vacate and fill. In the past, there was a burdensome paperwork process that you needed to go through in order to fill a vacant position. Today, the second that we get notice that somebody is leaving, the management team can move forward immediately to begin the recruitment process, to get that job posted and to start gathering candidates to interview. The next thing that we've done, and I think it's fairly innovative and unique to this department, is we have started recruiting across classifications. So again, looking at our family investment and child support specialist areas, the requirements and the skill set for those two positions are very similar. So if one of our local offices has vacancies in family investment, they do a interview panel, they go through numerous candidates. They have 5 people that would be really good for the department, but only 3 vacancies in family investment. They can use that interview to fill in child support. And we've now expanded that to across job postings, not just the interview panel itself. The next thing that we've done is ensure flexibility in opening job postings, creating lists, making sure that when there's a specialized need, we immediately reopen those lists. And a great example of the success that we had with this was in Kent County, where we received word from our local director that they had a factory closing in Kent County. So we immediately posted the list. They went out, they did their legwork and ensured that the factory folks knew that our list was open. We ended up hiring and filling 5 vacant positions there in Kent County for people who otherwise would have been out of work. Our next pillar is ensuring that we are marketing the department as an employer of choice, not as a last resort. Being very open and honest, all too often state employment, this has changed over the last 50 years, but state employment is the last resort. We can't allow that to happen anymore. We have to be better at making sure that people know and understand what we have to offer as an employer. And we have a very good story, we just don't tell it. So in order to tell that story, we're going to take a multi-channel communication strategy, which is going to actively engage in social media. We are going to make sure that we are making face-to-face contact in the state universities and in the local high schools around the local departments of social services. We have in November hired an individual whose background is in recruitment marketing. And as we sit here right now today, she is deep in it, working on our strategy going forward, and really how to engage a new workforce. The other thing that we make sure that we do is have the right voices at the table, and that includes ensuring that we are hearing from and working with our local departments of social services to understand what their needs are. And to understand what their resources are. Maryland's an interesting microcosm of the country. And what that means is needs in different parts of Maryland are different. So trying to put together a one-size-fits-all strategy without having the input of our local departments of social service is certainly going to fail. So we have to make sure we have the voices at the table. We are working to ensure that we have clear career paths in place, so that if we are recruiting folks out of high school, they have the opportunity to grow with us and to have long and fulfilling, sustained careers. But we're not, uninformed about what the labor market looks like today. We know that people don't just get hired and stay someplace forever. So we have to also look at how do we deal with that issue. Our fourth pillar of our plan is ensuring that we are building work environments that focus on balancing our needs as a department with the needs and well-being of our staff. One of the things that we learned during the COVID pandemic, and it's something that I desperately don't want us to squander, is the idea that we have the ability to be flexible. We have the ability to have staff telework and be successful. So building on that, we offer telework opportunities at least 1 day a week to at least 70% of our staff. We ensure, as we look at the telework opportunities, that the needs of our clients come first, foremost and always. So as we let people, or as we give people access to telework, we are making sure that we have the resources available in our local offices to service those folks who come to us day in and day out. So our next piece of that, building that new office environment, is ensuring that we are providing good feedback systems to our staff. We want to hear from them. In August of 2022, we did a comprehensive worker experience survey that has provided us with just a myriad of data to help us with our efforts and let us know and understand what our staff's needs are. In addition to that, we created in January of 2022 a centralized exit interview database. So when somebody puts their notice in, we begin processing. They're automatically sent a form to fill out, which then dumps into a database that we can query and get a picture of why people are leaving so that we can then address those issues. And the final piece of that flexibility, building the work environment, is ensuring that people are doing the things that they are here to do. And that's not saying that people are, not working. What I'm saying is we need to focus on the mission that we have. We need to focus on ensuring that we are providing the services to the families of Maryland in the most efficient and effective way, and that we are not getting bogged down in burdensome administrative tasks that can be done by other staff. It's specifically looking at folks who are doing services casework and making sure that they can focus their attention on the family first and not be filling out paperwork that's overly burdensome. The final pillar of our plan is making sure that we are continually looking at compensation equity and competitive compensation. As our analyst pointed out, we in November put into effect new base level hiring steps for all of our frontline staff. So that includes our family investment specialists, our child support specialists, and all of those caseworkers in the services area. The upshot of that is for entry-level positions in family investment, child support, they start at $43,000 a year. For our social workers, they're starting at $70,000 a year, and our social work supervisors are starting at nearly $90,000 a year. The other thing I want to point out, when we got the approval to make those adjustments to our hiring base, we then increased the steps for our existing staff to meet that base hiring step. So if somebody was below the base hiring step, we brought them up to match that in order to make sure that we were ensuring compensation equity. So the obvious question from that is, what have been the results? The first results are that we were able to fill 1,285 positions year over year as of today. We have to acknowledge that we also had 12,053 people separate from the department, and that's where we have to be more effective. That's what this plan is about on the retention side of the plan. The good news is we were positive 32 positions, which if you compare that to the last non-COVID year, we recruited significantly less folks in that year, and our net positive was 1. So we are starting to see the results that we're hoping for. And the most important thing to me is that graph on the side of the chart there, which is our 6-month turnover rate, and on a monthly basis. We have gone down from 1.67% monthly to 0.83%, a reduction of more than 50% in turnover rate in the last 6 months. So we believe that we are on the right track, and we are hoping that when we do give you the next update on our progress, we will be touting the success of the plan that we have formulated. With that, I want to thank the committee for your indulgence, and we are open to answer any questions you may have.
Nope, deeply appreciative. I just got 2 quick questions, more elevator response. When you talked about the approval of, I believe, the child support CCS, you stated when you talk about deepening the pool, who were you talking about approving? I assume it's DBM, but I don't want to assume.
I'm sorry, who approved that?
Yeah.
So it was a collaboration between the Department of Budget Management. It was also negotiated with our partners in the unions. And that was the path to that approval.
Okay. The second one is in reference to point one on page 14, also inside of the presentation. Could you just speak to like the morale, the impact on morale of the folks that are working beside folks that may have the lesser degree, but have been working for your respective agency for some time?
Yeah, it's right now, it's a little bit mixed. I was just talking to the local director out in Allegheny County yesterday. And she raves about the folks that they're hiring based on that change in job specs. There are others that are more skeptical that say, you know, the 18-year-old is not prepared to do our jobs. What I remind people is that fewer than 30 or just over 30% of Americans get college degrees. So if you're concerned about hiring that 18-year-old, don't. Hire the 35-year-old who has a high school degree, but has lots of life experience and can do the job.
I'm gonna open up, see if any, Senator Zucker.
Thank you very much, Mr. Chairman. Mr. Secretary, just an observation. It's interesting. I know that a number of my colleagues have been on budget committees for a while, and I just think it's very reassuring that there was a recommendation to restrict $100,000 that you concurred with, and I think it indicates two things. One is that you want to be held accountable. And two is you probably know you're going to do it. So thank you.
Yes, sir. Had the same feeling, Senator Zucker. Seeing no more questions, just want to thank you, Mr. Secretary, and your team, like I said, for the deep analysis in reference to what you all are doing around staff. And Ms. Camaro, just thank you again. And colleagues, at this time, this ends the hearings for HHS and look forward to seeing everybody tomorrow.